Hello, my name is Dr. Vidrine with South Carolina ENT. We want to thank our Facebook fans for submitting questions for the doctors to answer to try to help you guys out at home with all the questions you may have about your child's health. The Facebook question I'm going to answer for you today is, why do ear tubes fall out? I think the first part of the discussion is, why do we put ear tubes in? As you may know, ear infections are a very common ailment in the pediatric population. As a matter of fact, ear tube surgery is one of the most common outpatient surgeries performed in the United States. It's estimated about 500,000 sets of tubes are placed annually in the United States. We place the ear tubes for a variety of reasons. The most common reason is recurrent episodes of otitis media, which is an ear infection. We also place ear tubes for persistent fluid behind the ear, which can cause hearing loss and speech and language delay. The procedure is fairly quick and involves making a small incision into the eardrum, evacuating the fluid, and placing a tube across the eardrum. The purpose of the tube is to allow fluid to evacuate the middle ear and improve hearing, and also it helps the middle ear space aerate so that, in theory, we would expect less infections or eliminate the infections. This is important to try to keep your child off recurrent doses of antibiotics, which can be harmful over time. Most of us place short-acting tubes initially, which basically is a grommet-style tube or a narrow cylinder that fits across the eardrum. The diameter of the tubes we place are around 1 millimeter. The tubes we place normally should fall out anywhere between 6 months and 2 years from the time of placement. We often have follow-ups every 3 or 4 months to check the status of the tube. Sometimes the tube extrudes early, sometimes the tube drains purulent material, and sometimes the tube can be occluded by wax. If the tube doesn't fall out after a certain period of time, there are minor procedures to remedy that. So the specific question was, how do the tubes fall out? Like I mentioned earlier, the most common tube we place is a temporary tube that's a cylinder shaped. Anytime the body sustains an injury, whether it's a cut on the forearm or a planned injury like a myringotomy in the eardrum, the body repairs itself. The tubes are designed to slowly extrude as the eardrum repairs itself. 99% of the time, the tube will extrude into the ear canal and then fall out on its own, or sometimes we can scoop it out in the office on a follow-up visit. So that's why the tubes fall out. They're designed to fall out based on the body's response to the myringotomy incision we make at the time of surgery. There's one other type of tube we sometimes place called a T-tube. That's a more permanent style tube that generally does not fall out until 3 to 5 years down the road. These tubes are not placed for a child who is getting an initial set of tubes for ear infections. These tubes are placed under certain circumstances. If you have any other questions, our staff would be happy to help you answer those, and we'd be more than happy to see your child in follow-up. Our office number is 803-408-3277, and you can reach us on our website, www.southcarolinaent.com. Thank you for your question, and please be safe out there.